Hi, I'm Dr. David Hill, and today we're going to talk about how to stop a cold sore from spreading. Now, when we talk about cold sores, really, we're talking about a herpes simplex virus infection. There are several different strains of the herpes simplex virus. We used to say that the one that affected the lips was herpes type 1, and the part that affected the genitals was herpes type 2, and that used to be the case. However, for reasons we don't fully understand, the behavior of the herpes viruses has been changing. We now know that genital herpes may affect the lips, lip herpes may affect the genitals. Therefore, this neat assumption that lip herpes always stays on the lips and genital herpes always stays where it came from is no longer true. Now, cold sores are always unpleasant. They may tingle, they may burn, they may carry a lot of pain with them. They don't look particularly attractive if they're someplace that people can see. They tend to weep and crust over and get big and red. So people who have them want to know, how can I keep this from getting any worse? The most important thing is to get treatment as soon as the first sign of the sore occurs. If you wait longer than 1 to 2 days after the onset of the sore, it's very difficult to do anything about the course of the illness. Now, there are only a couple of medicines that are really effective against cold sores. The oldest is acyclovir, which is now generic, but you have to take it a little more often. There's also a newer medication called valacyclovir, which you have to take a little bit less often. But they essentially work on the same principle by stopping the virus that causes cold sores from replicating. There are a couple of ways to take these medicines, but really for most patients you're going to have to take it by mouth. Now, in very severe cases that lead to hospitalization, such as herpes affecting the eye or the brain, you actually have to give these medicines IV. But for most of us who are outpatients, you can expect to take pills, often several pills a day, for a short period of time, often about 5 days. There is Zovirax lip cream that includes acyclovir. However, unless you have HIV or some other immune suppression, it really hasn't been shown to be particularly effective. So for an immune competent patient, you're going to need to get pills from your doctor, either the acyclovir or the valacyclovir usually, to try and make the herpes go away. So remember, if you're getting a cold sore, regardless of where it is, you want to treat it as soon as possible, preferably in the first 2 days, usually with an oral antiviral medication. Talking about how to keep a cold sore from spreading, I'm Dr. David Hill.